Hello everyone, a very good morning again. I am Dr. Priyanka Sachdev here, and today I am here to take a series of mnemonic. We have started this mnemonic marathon in the morning. So in the morning we continued with pathology. Now it's time to study pharmacology. So let me give you some amazing, fantastic mnemonics from the pharmacology which will ease your questions of solving for solving pharmacology in your exam. So I will be giving you many mnemonics today in the entire pharmacology. More than 50 mnemonics will be there in today's class. Let me start with general pharmacology first, and after that, immediately after that, I will move on systemic pharmacology, and one by one we will take the mnemonics from the entire systemic pharmacology. I will be little bit fast. I'm assuming that it is a revision class. You already know the basics, so I will not explain you the concepts behind each mnemonic. It is a mnemonic class just to ease your learning. So mnemonics are not conceptual, right? It is just for easier of your learning. You want to learn a list of drugs. So I will give you a mnemonic to learn that list, right? So without wasting time, let me start pharmacology. Are you people there? Okay. So the first mnemonic in pharma is in front of you. That is mnemonic for prodrugs. Just a second. Let me use the pen. Okay. Why it is not coming? Give me a minute. Okay. So here I am. So the first mnemonic is in front of you. The mnemonic is of prodrugs. By the way, what are prodrugs? Do you know what are prodrugs? So prodrugs are the drugs which are inactive in human body, and after going in the body, the liver converts the inactive drug into the active drug. Have a look on this diagram, then I will give you the mnemonic. So you can see in this diagram, this is the drug taken by the patient by oral route, by mouth. So the drug is going in the mouth of the patient, the drug is going in the esophagus of the patient, the drug is going in the stomach, the drug is going in the intestine. Now there is a rule that acidic drugs are absorbed from acidic medium, that is stomach, and basic drugs are absorbed from basic medium, that is intestine. So depending on the drug is whether acidic or basic, it is absorbed either from stomach or intestine, and finally the drug reached in the blood. Now some drugs are active, they are active in the blood. So directly from the blood, they will go to their site of action. So depending if the drug is a painkiller and I'm having pain in the head, so it will go in the cranial parenchyma, it will go in the blood vessels of the cranial parenchyma and act there. If I'm having diarrhea, the drug will go in the intestine and show its action there. If I'm having heart failure, drug will go in the heart and show its action there. Depending what is the disease, where are the receptors of that drug, the drug will go to its site of action and show its mechanism of action there. But this is the scenario only when this drug is active. What if the drug is inactive? There are some drugs which are inactive. Such drugs are known as prodrugs. So these drugs cannot go to the site of action and show their action since they are inactive. So these drugs first go to the liver. Liver convert inactive drug into active drug. And after converting from inactive form to active form in the liver, they again come in the blood, and from blood they can go to the site of action and show their mechanism of action. So such drugs are known as prodrugs. Basically these are the inactive drugs. Just a second. These are the inactive drugs which are converted into active form in human body after reaching the human body, and the activation is done by the liver. So it is a very important mnemonic. Many questions come, which of the following is a prodrug, which of the following is not a prodrug. You should know the list. So the list is in front of you. The mnemonic is all prefer doing MD in clinical subjects. I guess every one of you also prefer doing MD in clinical subject. Yes or no? So all prefer doing MD in clinical subject. Let me tell you the full form of this mnemonic. All ka A stands for ACE inhibitors. What are ACE inhibitors? ACE inhibitors are pril. They have the suffix pril. Captopril, enalapril, ramipril, lisinopril. There are many prils. The suffix is pril. So all pril are prodrugs except two pril, which are not prodrug. Captopril and lisinopril. That is, you can learn CL. Captopril and lisinopril, these are the two prodrugs which are not, these are the two ACE inhibitors which are active directly. These are not prodrugs. Except these captopril and lisinopril, rest any pril, any ACE inhibitor, it is a prodrug. So that you have to learn, right? Exceptions pe bahut question aate hain. Examiner loves exception. Prefer pe there are three drugs. P. So it is prednisolone, it is a steroid. PPI, it is used in acidity, and proguanil. So these are the three drugs in on the P. Doing ka D is dipivafrin. M, again three drugs. Mercaptopurin, methyl dopa, and minoxidil. D for dopa, levodopa. D for dopa. Levodopa is a prodrug which is used in Parkinsonism. It gets converted into dopamine in the body. Levodopa get converted to dopamine. C again stands for three drugs. Cyclophosphamide. You know cyclophosphamide, it is an anti-cancer drug. Clopidogrel and carbimazole, right? And subjects ka S stands for sulfasalazine. Sulfasalazine is an antibiotic used in some intestinal diseases. Give me a thumbs up. So this is the mnemonic. So can you tell me what is the mnemonic? I will show you the questions based on that. So it will be easy for you to learn the mnemonic. The mnemonic is all, prefer, doing, MD in clinical subjects. Everyone first give me a thumbs up. You got my point? So you should know the full form of these. So shall I say the full form or you will learn by yourself? Okay, let's have a look on some questions. So it will be easy for you to learn this mnemonic. Okay, this is the first question in front of you. I want everyone to give the correct answer. Everyone. So please participate in the poll. Which of the following is not a prodrug? I'm asking not a prodrug. Apply the mnemonic. The mnemonic is all, prefer, doing, MD in clinical subjects. Can you tell me can you tell me what is the correct answer? So people started answering. Soumya, Aftab, Suman, Haranpreet, you all are right. You are saying B as the correct answer. Okay, what is this A? A is ACE inhibitors. ACE inhibitors means prill. I am saying all prills are prodrug except two prill. The answer is captopril and lisinopril. These two prills are not prodrug, they are directly active. So the correct answer here is lisinopril. Lisinopril is not a prodrug. It is directly an active drug. Rest all prills are prodrugs. You can see levodopa. Levodopa is D here. Dopa ka D hai. You can see carbamazole. Carbamazole is one of the C. And you can see prednisolone. Prednisolone is one of the P. So remaining three options are coming in this mnemonic. Rather, this option is also coming in the mnemonic. You will say, ma'am, captopril is a ACE inhibitor. You said ACE inhibitor, but I told you two exceptions also. You have to take care of those exceptions. So correct answer here is B, and all of you right. All of you are right. Have you got it? Shall I proceed ahead? This is the next question in front of you. All of the following are prodrugs except. Again, the question contains except. Now apply the mnemonic and tell me the correct answer. Tell me the correct answer. So is it aspirin? Is it dipivafrin? Is it levodopa? Is it captopril? So the same concept. So as I've told you, all ACE inhibitors are prodrugs except captopril and lisinopril. So the correct answer here is captopril. Captopril is the ACE inhibitor which is not a prodrug. Rest all prodrugs, ACE inhibitors are prodrugs, and other three are coming in the mnemonic. That's why the correct answer here is D, and you all are right. Very good. See the next question. See the next question. Okay, we have applied this mnemonic. See the next question. The next question is in front of you. Can you tell me the correct answer? Which of the following is a prodrug? I'm asking which of the following is a prodrug. Have a look on the options and tell me what is the correct answer here. See the four options. Is it ampicillin? Is it captopril? Is it levodopa? Is it phenytoin? You apply the mnemonic. All, prefer, doing, MD in clinical subjects. So this is the mnemonic. So A is ACE inhibitor, not ampicillin. No, ampicillin is not a prodrug. It is not a prodrug. All ACE inhibitors are prodrug except captopril and lisinopril. So captopril is also not a prodrug. It is an exception. And P, phenytoin. So P is prednisolone here. P is proguanil here. P is PPI here. But P is not phenytoin. No, phenytoin is not a prodrug. It is directly an active drug. So the correct answer is levodopa. D stands for dopa. So levodopa is a prodrug which get converted into dopamine, and you all are right. Very good. Very good. Very good. Add aspirin also. Harmanpreet, add aspirin in the list. So along with ACE inhibitors, you can add aspirin also. It can be a prodrug. You can consider this as a prodrug, right? So it is salicylate. So first it is a prodrug, and that it gets converted into the active metabolite in the body. So the correct answer here is C, and you all are right. So you can see how many questions are coming on this mnemonic. Let's come on the next mnemonic. In the next mnemonic, before giving you the next mnemonic, let's have an overview of metabolism. What do you mean by metabolism or biotransformation in human body? Okay, listen. Again, have a look on this diagram. Where is my diagram? Just a second. You know, biotransformation is of two types. What is biotransformation? Give me a minute to come on that slide again where I want. Just a second. Just a second. Let me come on that diagram again. Yes, I want to show you this diagram again. Why? I want to show you what is metabolism. Listen, this is the drug taken by the oral route. This is the drug taken by the oral route. You can see the drug is going in the mouth, the drug is going in the esophagus, in the stomach, in the intestine, getting absorbed reaching the blood. After reaching the blood, it is going to the site of action, show its mechanism of action. Now the job of the drug is done in the body. Drug cannot be kept in the body forever. We want to excrete this drug. So this drug will go to the kidney for excretion and ask the kidney, can you excrete me in the urine? I want to get excreted out of the body. My job is done. So kidney will say no, because I will excrete only that drug in the urine. Urine is water. So I will take only water soluble drugs in excretion. Otherwise, if you are not water soluble, I cannot excrete you. So for getting excreted in urine via kidney, the drug should be polar. Polar means water soluble. But most of the drugs are non-polar. They are non-polar. They have already shown their mechanism of action, but now they cannot be excreted. So for converting a non-polar drug to polar drug, liver is the organ. Non-polar drug to polar drug. Water insoluble drug to water soluble drug. And water or lipid are opposite, or you can say what lipid soluble to lipid insoluble. So this is the definition of biotransformation or metabolism. It is done by liver. So liver does a process in which liver converts non-polar drug to polar drug, water insoluble drug to water soluble drug, or lipid soluble drug to lipid insoluble drug. That is known as biotransformation or metabolism. So there are various ways of doing biotransformation or metabolism. Let me come on those ways. So there is a mnemonic for them. So it is of two types, phase 1 and phase 2. Phase 1 is of 5 types and phase 2 is of 6 types. So what are the types? Does anyone know? Does anyone know what are the 5 types of phase 1 and phase 2? 6 types. These are 5 types. These are 6 types. Total 11 types of biotransformation or metabolism is there, which is done by the liver. So the phase 1 5 type is oxidation, reduction, hydrolysis, cyclization, decyclization. I'm not going to give you any of the mnemonic here. So these are the 5 type of phase 1: oxidation, reduction, hydrolysis, cyclization, decyclization. Important is phase 2. Let me come on phase 2. Phase 2 is of 6 type. All phase 2 are conjugation. So there is a mnemonic triple G and SMA. Triple G, SMA. So depending who is conjugating with the drug and convert it from non-polar to polar form. So it is glutathione, is it glycine, it is glucuronide, is it sulfur, methyl or acetyl group. Out of these 6, the most important is acetylation. Many question comes from acetylation. You should know the examples of all these. But maximum question comes on the examples of acetylation. So I will give you a mnemonic for acetylation. Here, the drug will combine with the acetyl group and get converted from non-polar to polar. So the mnemonic is in front of you. Here is the mnemonic. The mnemonic is CHIPS. CHIPS ABC. What is this mnemonic? This mnemonic is for acetylation. These are the drugs which are metabolized by acetylation. Acetylation in the liver. What is acetylation? It is a type of conjugation, which is a type of phase 2 metabolism. You know what is metabolism. So by acetylation, the non-polar drug will get converted into polar drug. List the drugs. So C stands for clonazepam. It is a type of, sedative, clonazepam. Right? H stands for hydrolazine. I stands for isoniazid. Hydrolazine is the arteriodilator. It is a vasodilator. Isoniazid is an anti-tubercular drug. It is an antihypertensive drug. It is an anti-tubercular drug. This one is a sedative. P stands for procainamide. Procainamide is an anti-arrhythmic drug. We all know that. S stands for sulfonamides. Sulfonamides, sulfonamides. Sulfonamides में Dapsone भी आ जाएगा. Dapsone, or you can add ABCD. If you are not considering Dapsone as one of the sulfonamide, you can add ABCD. Dapsone अलग से add कर लो. Otherwise, you should know Dapsone is one of the sulfonamide. ABC. A is ace-butamol and ambrinol and ASA. Right? B is benzocaine and C is caffeine. The caffeine present in coffee. So say the full form and see how many questions comes from this mnemonic. So CHIPS ABC. Anusha, yes, CHIPS को आगे और बढ़ाओ ABC. So CHIPS ABC or ABCD. So say the full form. CHIPS ABCD. So 5 plus 4, total 9 drugs are there. You should say the list again. Let's apply this mnemonic in some question. See, have a look on this question. Can you tell me the answer of this question? All of the following are metabolized by acetylation except. The question contains except. Apply it. Can you apply it? All of the following are metabolized by acetylation except. Can you tell me the answer? Is it phenytoin? Is it procainamide? Is it isoniazid or is it hydrolazine? What is the mnemonic? The mnemonic is CHIPS ABCD. SHIPS ABCD. ABC or ABCD. Right. Apply this mnemonic. Who will tell me the correct answer? You already started. Everyone is right. Very good. Very good. You all are saying A. Okay, let me see. I is isoniazid. This I is isoniazid. H is hydrolazine. Yes, this H is hydrolazine. P is procainamide. Yes, this P is procainamide. This P is not phenytoin. Phenytoin is not metabolized by acetylation. So the correct answer here is A. So knowing the full form is important. Now P is there in the mnemonic, but in the exam, if you don't know the full form, you will get confused whether this P is phenytoin or procainamide. You got my point? So knowing the full form is more important. So correct answer here is A. You can see P is procainamide. P is not phenytoin. Right? So that is the thing. So coming on the next question, which of the following drug is metabolized by acetylation? It is metabolized by acetylation. I'm not asking the exception. See the four option. Is it phenytoin? Is it isoniazid? Is it salbutamol? Is it haloperidol? Again, it is a very easy question. The mnemonic is CHIPS ABCD. CHIPS ABCD. Now apply this mnemonic on the four option. Which option is coming in this mnemonic? Which option is coming? You all are right. Very good. Very good, Soumya. Devashish, Anu, Osama, Nikhil, Suman, Harmanpreet. Very good. So the correct answer here is isoniazid. Here I stands for isoniazid. That's why this is the correct answer. Here H is coming. Here H is coming in the mnemonic. But this H is not haloperidol. This H is hydralazine. You got my point? P is also coming in the mnemonic. But P is not phenytoin. P is procainamide. You got my point? And S is also coming in the mnemonic. It is not salbutamol. It's sulfasalazine. You got my point? So you should know the full form. Otherwise, in the exam, if you word the one letter only, the initials, you will get confused in the exam. You get my point? P, S, and I, H, everything is coming in the mnemonic. So you should know the full form. I guess you got my point. So I should proceed ahead to the next mnemonic. So CHIPS ABCD. ABCD is a very, very important mnemonic, right? Coming on the next most important topic. So as I've told you, liver. Can you see here liver? In this diagram, in my diagram, can you see there is a liver? So liver is the organ which convert non-polar drug to polar drug. As I've told you, and this is known as metabolism. The non-polar drug get converted to polar drug, right? So this is a drug, the patient is taking the drug. Just suppose I am the patient, I am taking a drug by oral route, I am taking it with a glass of water, right? So drug is going in my esophagus, drug is going in my mouth, esophagus, stomach, intestine and getting absorbed. Ultimately, drug is reaching in the blood. From the blood, drug is going to the site of action and shows its mechanism of action and curing my disease. The job of the drug is done. Now, drug want to get excreted via kidney, but kidney is not excreting the drug because the drug is non-polar. So, this drug is present in the blood and it is non-polar and it is unable to go to the kidney because kidney is not excreting it because the drug is non-polar. So, this drug is going to the liver and asking the liver, requesting the liver, I am a non-polar drug. Can you convert me to polar drug? You are an organ which do the metabolism. My job is done. So, please convert me from non-polar to polar so that I can excrete it out of the body. So, liver is saying, yes, I can do so. Please, you enter inside me, inside my cell. There is a cell known as hepatocyte. So, inside my cell, in my endoplasmic reticulum of my cell, there are certain enzymes. The name of the enzyme is cytochrome P450. That enzyme will convert you from non-polar to polar, right? So, that enzyme will convert you from non-polar to polar. So, drug was very, very happy. Drug entered the liver, inside the hepatocyte, inside the endoplasmic reticulum. Drug is going to cytochrome P450 and cytochrome P450 converting the drug from non-polar to polar. Why I'm telling you this story now in the mnemonics? So, okay, the story was very easy when I was taking only one drug, that is drug A. So, see only first drug A, the red color drug. Don't see the green color drug. See only drug A. So, when I was taking only drug A, can you see a liver? Inside the liver, can you see a hepatocyte? The cell is the hepatocyte. Inside hepatocyte, can you see this is endoplasmic reticulum? This is endoplasmic reticulum. Inside the endoplasmic reticulum, can you see a purple color enzyme? This is cytochrome P450. This is the enzyme cytochrome P450. So this red color drug is entering inside and asking cytochrome C to convert me from non-polar to polar, and it was doing it. The drug got converted from non-polar to polar and excreted out of the body via kidney. It is excreted. The thing was very simple. But patient don't come to doctors only with one disease. They say, doctor, I am having hypertension also, I am having cold and cough also, I am having fever also, I am having acidity also, I am having this also, that. So you prescribe multiple drugs at one point. It is not you prescribe one drug and the patient have multiple comorbidities. Patient is diabetic, hypertensive, he is already on some drugs and you are adding some more drugs for the current disease, right? So you always give the combination. Just suppose you are giving two drugs to the patient, drug A and drug B, right? So the drug B is the inhibitor of cytochrome P450. It can happen. There are some drugs, this cytochrome P450 is a unique enzyme. It can be stimulated, that is induced, and it can be inhibited by some drugs. So imagine the situation now. So my patient is taking two drugs together, drug A, drug B. Both drugs are going and are getting absorbed and going in the blood of the patient. From the blood of the patient, drug B and A both are going to the liver. Drug B is inhibiting the enzyme. It is an enzyme inhibitor. See, it is minus here. It is inhibiting the enzyme. So this cytochrome is non-functional now. It will not function. So when drug A asks cytochrome, can you convert me from non-polar to polar? So the cytochrome is saying no. The liver is saying no. I cannot convert you from non-polar to polar because I am inhibited by some other drug. I am non-functional now. So I am sorry, I cannot convert you. So drug A will remain non-polar only. It cannot be converted into polar. So it cannot be excreted in the body. It will remain in the blood only. It cannot be excreted. It will cause toxicity. It will cause toxicity because of over concentration in the blood. So it is not excreted. So when we give two drugs and drug A is here drug A is known as substrate drug. It is the main drug, substrate drug, parent drug, target drug, whatever you say. And drug B is known as inhibitor drug. So never give this combination to your patient. Being a doctor, you should know this combination. Which drugs are substrate drugs and which drugs are inhibitor. Never give these together. So many students ask me this question, ma'am, what if the combination is really necessary and no other possibility is there? So to save the patient in some situation, I'm stuck and I have to give such a combination in which there is a parent drug, substrate drug, and I have to give the inhibitor, one of the inhibitor drug. What in that case? So I will say in that case, okay, give the combination, but reduce the dose of the parent drug, because otherwise if you give the standard dose of both the drug A will cause toxicity. Toxicity occurs of drug A, not of drug B. Toxicity occurs of parent drug, not the inhibitor. You got my point? Do you have any question on this? Listen, now list of such drugs. So consequences toxicity. Toxicity of which drug? A ki B? It is A. Toxicity of the parent drug, object drug, substrate drug, not of the inhibitor. You got my point? Now listen, in this list of A, I will give you a mnemonic for A and list of B. A is the parent drug, uska mnemonic CT scan. I will tell you the full form. Or B ka mnemonic vitamin K cannot cause enzyme inhibition. Okay, let me show you the two list. So, okay, here the mnemonic CT scan, I have not put the full form. The B one, that is inhibitor, the enzymes inhibitor. You can see enzyme inhibitor, this is the mnemonic. So mnemonic is vitamin K cannot cause enzyme inhibition. Say the full form. Vitamin V is valproate. V is valproate. K is ketoconazole. You know valproate, it is a calcium channel blocker. Ketoconazole is an antifungal drug. Cannot ka C is cimetidine. It is used in acidity, right? It is proton inhibitor and it is anti-acidity drug. Causes mein ek aur C hai, ciproflox. So 2C, one is cimetidine for acidity, one is ciproflox for antibiotic. It is an antibiotic. Enzyme ka E is erythromycin. It is also an antibiotic. And inhibition ka I is isoniazid. It is an anti-tubercular drug. So never give these drugs with other drugs. Try to avoid these drugs in combinations. Give me a thumbs up, especially with the substrate drugs. Never give these drugs. If you are giving these drugs, reduce the dose of the substrate drug. Give me a thumbs up. Give me a thumbs up. So this is the mnemonic. So this is about the inhibition. Now the reverse can happen induction whenever you are giving combinations. Now listen the story again. Listen, you are giving two drugs. Can you see now the two drugs? Drug A and drug B. Both you are giving together. When you were giving drug A only, it was very simple. Drug A was going to the liver, to the hepatocyte, to the cytochrome, and cytochrome was converting drug A from non-polar to polar. And drug A was excreted out of the body. Drug A was very happy. But now you are giving drug A with drug B. Can you see drug B? This time drug B is inducing the cytochrome P450. It is not inhibiting, C plus sign. It is inducing. So this enzyme becomes hyperactive. This enzyme becomes hyperactive. So it will convert drug A non-polar to polar before drug A shows its action. I want the metabolism for drug A, but after it shows its mechanism of action, then I want its excretion. Just suppose I am taking a drug A. I am having a disease. The treatment is drug A. I want drug A to go inside to get absorbed. From the blood, it should go first to its site of action, show its mechanism of action, then it should be excreted, then it should go to the liver for metabolism and kidney for excretion. But if the enzyme is hyperactive, if I am taking a drug A, it will go in the blood and directly from the blood, it will go to the liver and get metabolized and excreted. So before drug shows its mechanism of action, it is excreted out of the body. So it is a wastage. You know, it is a wastage. So it decreases the intensity of effect of the drug if you are giving this combination. So again, never give this combination. And if it is very necessary to give the combination, increase the dose of the parent drug. Increase the dose. So what are the list of inducers? What is the list of the inducer? So inducer ka consequence kya hai? Consequence, it decreases the intensity and duration of action of the main drug, the parent drug, the object drug. So what is the list here? The list is in front of you. GPRS, cell phone, battery dead. The mnemonic is in front. I have extended the mnemonic. GPRS, cell phone, battery dead. G is grisofulvin. Grisofulvin is also an antifungal drug. Ketoconazole is also an antifungal drug. But ketoconazole, it is an inhibitor. And grisofulvin, it is an inducer. Both are antifungal drug, right? P is phenytoin. P is phenytoin. It is an anti-epileptic drug, and C is carbamazepine. It is also an anti-epileptic drug. So in this mnemonic, two anti-epileptic, anti-seizure drugs are there. You may be knowing anti-epileptic or anti-seizure drug ka classification. So phenytoin and carbamazepine both are anti-epileptic or anti-seizure drugs. R is rifampicin. Rifampicin is an anti-TB drug. Isoniazid is also anti-TB drug, but isoniazid is an inhibitor and rifampicin is an inducer. Both are anti-tubercular drugs. HRZES का एक H है और एक R है. You know the 5 primary anti-TB drugs. S is smoking. S is smoking. Smoking is considered as a drug. Phone का P is phenobarbital. Phenobarbital, you know, barbiturates. These are the sedatives, right? Battery is barbiturate. So one and the same thing. Either you say barbiturate or you say phenobarbital, एक ही बात है. So dead is DDT. Dead is DDT. Give me a thumbs up. So never give these drugs with other drugs. If you are giving these drugs with other drugs, increase the dose of others, not these. These are inducers. Give me a thumbs up. Now there are many. You can't imagine how many questions occurs from this point. So tell me, who will tell me the list of inducers? First tell me, just a second. You tell me the list of inducers first. And you tell me the list of inhibitors. Inhibitors. Tell me the two list. And we will revise and we will come on a conclusion and solve the question. Inducers ka list kya hai? The list is G, P, R, S, cell, phone, battery, dead. Is it visible to you? G, P, R, S, cell, phone, battery, dead. What is the list of inhibitor? Inhibitor is vitamin K. Cannot cause enzyme inhibition. Everyone give me a thumbs up. Everyone. Now in this list, so okay, where you will get confused. Let me tell you confusion of the students. So here there is a C, here there is a C, and here there is a C. Students highly confused in C. You should know the C, all C. Here C in inducer, it is carbamazepine. Carbamazepine, it is an anti-epileptic drug along with phenytoin. So phenytoin and carbamazepine both are coming in inducers. Here the 2C, one is acidity, one is antibiotic. The acidity one is simantidine, ranitidine, simantidine, you know that simantidine, proton inhibitor, right? And the other is ciproflox. Ciproflox is one of the flox, Oflox, Levoflox, ciprofloxacin. It is one of the quinolones, fluoroquinolones I must say, right? So पहले तो C का फंडा clear करो. Everyone give me a thumbs up. Apart from C, tell me the full forms of others. So G is grisofulvin here. Grisofulvin, it is an antifungal drug. Here also we have ketoconazole. It is also an antifungal drug. So we have two antifungal drugs. One is inducer, one is inhibitor, right? Apart from it, we have rifampicin here. Rifampicin here, which is an anti-TB drug. And we have isoniazid here, which is also an anti-TB drug. So both are anti-TB drugs, but one is inducer, one is inhibitor. Give me a thumbs up. Apart from it, you should continue the list. It is, I guess, it is smoking here. It is phenobarbital. Phenobarbital is one of the barbiturate. So barbiturate and DDT. So I am done with this list. That list में क्या-क्या बच गया? Here valproate हो गया. यहाँ पे erythromycin. Erythromycin, which is also an antibiotic. So everyone give me a thumbs up. This is how you have to do a comparative analysis of the two list. Not only this. Let me finish. Not only this. Before leaving, you should know if you are giving these drugs, inducers with any other drug, you should increase the dose of not these drugs, the object drug. Increase the dose of object drugs, otherwise there is less intensity or duration of action of that object drug. If you are giving these drugs with any other drug, so decrease the dose of the object drug, the other drug which you are giving that, right? Decrease the dose because they will cause toxicity. Everyone give me a thumbs up, everyone. So Vibhavati, Osama, Harmanpreet, you got it? Should I proceed ahead? Would you like to solve some questions on it? The confusing questions. So here is the first question. Can you give the answer? Which of the following drug is an enzyme inducer? Apply the mnemonic. I am asking inducer. Inducer का mnemonic है GPRS cell phone battery dead. GPRS cell phone battery dead. Can you apply the mnemonic? What is coming in this mnemonic? The other mnemonic is vitamin K cannot cause enzyme inhibition. So the examiner is asking for these inducers. The examiner is not asking for inhibitors. See the first option. What is correct? You all are correct. So Harmanpreet, Soumya, Osama, Devashish, Nikhil, Anu, Lavanya. Yes, the correct answer is rifampicin. So rifampicin is coming here. I'm sorry, this is rifampicin. But isoniazid, ketoconazole and erythromycin. Isoniazid, erythromycin and ketoconazole. The remaining three are inhibitors. So you can see the remaining three options. So you will get confused in your exam. You should know the two mnemonics separately and the consequences of the two. Give me a thumbs up. Yes, the correct answer here is A. Coming on the next question. The next question is in front of you. You can apply the mnemonic. Just a second. This is the next question in front of you. All of the following are enzyme inhibitors except which of the following is not an enzyme inhibitor? What is the mnemonic for enzyme inhibitor? What is the mnemonic? Vitamin K cannot cause enzyme inhibition. See the option which is not coming in the options. So tell me that drug. So you will get confused. Okay, V is valproate. It is definitely coming here. It is definitely coming here. K is ketoconazole. It is definitely coming here. What about the two C's? One C is simantidine. One C is carbamazepine. What are these two C's? If you know the full form of these two, you can solve it. One C is acidity. That is simantidine. It is simantidine. What is the other C? Other C is not carbamazepine. Other C is ciproflox here. Other C is ciproflox. Now you tell me the correct answer. So simantidine is coming here. Yes, but carbamazepine is not coming. So the correct answer here is carbamazepine. Carbamazepine is an enzyme inducer. It is not inhibitor. It will come in GPRS, cell phone, battery dead ka cell. Cell ka C is this carbamazepine. So correct answer here is A and you all are right. Very good. The correct answer here is A. This is how you have to apply, right? The next question. Cytochrome P450 is inhibited by. Tell me the drug. Inhibitor. I am asking inhibitor. Again apply the mnemonic. Vitamin K cannot cause enzyme inhibition. So tell me which drug is coming. Which drug is coming? Is it phenobarbital coming in this mnemonic? No, it is not coming. Is it phenytoin coming here? No, it is not coming. Both of these come in inducers. What about CCl4? No, it is not coming. Yes, one of the C is simantidine. So you see option B is correct. There are two C. One C is simantidine, one C is ciproflox. So the correct answer here is B. And you all are right. Yes, simantidine is the correct answer. Very, very good. This is how these mnemonics will save you, save your skin in the exam. Otherwise, you will die, right? So the correct answer here is B. The next confusing question. All these are previous year questions. None of them is a new question. All of them are previous year questions already asked in the previous year exams, either in NEET PG or INICT or FMG or PGI or JIPMER or AIMS, right? I have taken the previous year question of all the exams related to this topic. Right, see the next question. Which of the following is a P450 inhibitor? Again, I am asking inhibitor and people started answering. I am asking inhibitor. So apply the mnemonic of inhibitor. Vitamin K cannot cause enzyme inhibition. So tell me, okay, two answers are correct. So write down your two answers. In this question, two answers are correct. It is a PGI question. So give me two answers. Who will get to give me? So most of the students are saying A. What? Only one is correct. So this is your problem. Most of the students, what they do, they read the first option. Oh, option number A is ketoconazole. They just apply. Okay, it is coming here in this mnemonic. They get hyper excited and they just tick it correctly. Okay, this is correct. I agree this is correct, but one more option is correct. Yes, Osama, Harmanpreet, Vibhuti, very good. One more is correct. So ketoconazole is coming here. Rifampicin is coming? No, rifampicin will come in GPRS cell phone. GPRS का R है rifampicin. Phenytoin is coming? No. GPRS का P है phenytoin. So these two are inducers. What about isoniazid? INH. What is about isoniazid? This is isoniazid. So ketoconazole and isoniazid both are coming here. So the two correct answer are A and D. So you should be able to answer it correctly. It is not the thing that you should apply. So most of the students do. यहाँ पे तो दो answers correct हैं. So it is a PGI question. But sometimes option A, reading option A, examiner misleads you, giving such option A that you know tempts you to take it. But this is not the correct answer. Once you read the other three option B, C, D, you will find a better option than A. So but in hyper excitation, in that temptation, you just tick it A and you just don't even bother what is B, C, D. So make a habit. Being a good student, whenever you attempt an exam, read all four options before marking it. Even A is correct. You are 100% sure A is correct. You don't know that BCD में कुछ भी हो मैं तो A ही mark करूंगा करूंगी तो भी read down BCD. Maybe sometime BCD में you have a better option which is more appropriate for this question. So make it a habit. Otherwise BCD rule out. No, this is not, this is not, this is not. So you will get 100% sure that A is correct. And BCD are not correct, right? This is the thing. Here two options are correct. Let me move ahead. The correct answer here is A, right? Let me tell you another mnemonic. Till now we have seen many mnemonics of the acetylation. We have seen the mnemonic for what? The first mnemonic, inducers. We have seen the mnemonic for inhibitors. We have seen the mnemonic for prodrugs. Now it's time to study first pass metabolism. What is this first pass metabolism? Listen, as I have told you, whenever patient takes any drug by mouth, this is the patient taking the drug by mouth. Can you see? The drug is going in the mouth, in the esophagus, in the stomach and in the intestine. So the drugs are absorbed from stomach, acidic drugs and basic drugs are absorbed from intestine. Ultimately, drugs reach in blood. What is the name of this blood vessel? What is the name of the blood vessel of the GIT? This is GIT now. This is your esophagus, this is stomach, this is intestine. So drug is absorbing from stomach and intestine. So name the blood vessel. Is blood vessel ka naam kya hai? Can you tell me the name of blood vessel? Can you name that blood vessel? It is portal vein. Of course, it is portal vein. Portal vein is the vein of GIT. We all know that. So drugs are absorbed in the veins, right? It is absorbed in the portal vein. Where does the portal vein first go? All the drug present in the portal vein first go to the liver. Portal vein. Liver have dual blood supply. Liver get one of the blood supply from the aorta, hepatic artery, the pure blood. And liver get impure blood from the GIT, that is portal vein. So basically here I want to tell you that all the drug here present in the blood after absorption first going in the liver. And in the liver cytochrome is already present, right? And cytochrome converts the drug from non-polar to polar, metabolize the drug and drug will get excreted. But oh my God, the drug have not even shown its mechanism of action. First I want the drug to go here, show its mechanism of action. Then I want the drug to go in liver and kidney to get metabolized. But this don't happen usually. Usually the drug first go in portal vein, first go in the liver metabolize a fraction of the drug. The remaining drug will come in the blood and from the blood then it will go to show its mechanism of action at the site of action. You got my point? So there are some drugs when they first go to the liver out of the 100%, 90 or 99% of the drug is metabolized. So it is just wastage. You are taking a 100-gram tablet, 99 gram is excreted. It is excreted in urine without showing its action. So only 1 gram is coming in the blood. So these drugs are showing high first pass metabolism. Those drugs, I will give you a list of those drugs. So being a doctor, you should know the list of those drugs. Never give those drugs with oral route. Give some other route. Now give IM, IV, subcutaneous, some other route. Because if you give them by oral route, they will go in portal vein. By oral route, they will go in stomach and intestine. From stomach and intestine, they will go in portal vein. From portal vein, they will go first in liver and liver will destroy it. Liver will metabolize it, liver will excrete it without showing mechanism of action. You do not want that. That is just a wastage of the drug, wastage of money, wastage of efforts. The patient will not have any effects of the drug. Although patient is taking the drug, he will not have any effects of the drug. So it is not the thing. So you should know the list of the drugs which have high first pass metabolism. This is known as first pass. The first pass is in the liver and liver is destroying it. That is first pass. In the first pass, the drug is metabolized. So drug is not even going to its site of action. Before that, the drug is already metabolized and excreted by the kidney without reaching the site of action. So if I'm having migraine headache, I want the drug to reach my cranial blood vessel and treat my headache. So if I'm taking a tablet for it, for the migraine, the tablet is going my esophagus, stomach and intestine, getting absorbed from the stomach and intestine, depending the drug is acidic or basic, right? The drug after absorption in the blood, the drug, it will be absorbed in my portal vein. From stomach and intestine, it will be absorbed in my portal vein. From portal vein, it will go to my liver. Now it's the choice. For some drugs, liver do a high metabolism. So out of the 100%, maybe 90, 95% get metabolized. And after metabolization, it will come in the blood and go to the kidney and get excreted directly. But the drug which is coming without metabolization, that will come in the blood and finally it will reach the systemic circulation and reach the site of action, that is the brain I want. So the drugs which is having high first pass metabolism, that is not given by oral route. The same diagram is shown to you. So whatever drug you are taking by oral route, that is going in the intestine, stomach and intestine. From stomach and intestine, the drug is going in portal vein. From portal vein, the drug is going in liver and liver is metabolizing it and excreting it. Give me a thumbs up. Give me a thumbs up. So this is first pass metabolism. From the stomach and intestine, the drug is going to the liver and liver is metabolizing it. The remaining one will come in the blood, the remaining one. Now, what is this remaining 1%? That depends, right? So the drugs with high first pass metabolism, this is the mnemonic. I'm having a mnemonic for it. So the mnemonic first pass metabolism ka ek aur naam hai. One more name is given. It is not written here. First pass metabolism is also known as pre-systemic metabolization. Why it is known as pre-systemic metabolism? Pre-systemic. Because before reaching the systemic circulation, this is the systemic circulation. I want the drug to reach here and go to its site of action to show mechanism of action. This is systemic circulation. Before reaching systemic circulation, drug is metabolized in the liver. Before reaching here, this is known as pre-systemic metabolization. So this is the other name given to first pass metabolism. Give me a thumbs up if you got the meaning of this name. Pre-systemic metabolism is the other name given to first pass metabolism. Now have a look at the mnemonic. So I am giving you a mnemonic for the drugs which shows high first pass metabolism. Being a doctor, Why you should know the list of these drugs? You are a doctor now. Never give these drugs by oral route. So these drugs ki tablets are not available in the market. Tablets, capsules, syrups not available. These drugs either come by IV route or IM route, or it comes in the tablets. Nitrates ki tablets aati hain, but not for taking with water, oral route. No, you have to take sublingual tablet. So take a tablet of nitrate and ask the patient to keep it below the tongue. Here, below the tongue, so that it directly absorbed in the blood vessels of the tongue. It should not go in intestine and get absorbed in portal vein. You got my point? So the mnemonic is in front of you. Nitrates have large pre-systemic metabolism. The pre-systemic metabolism is first pass metabolism. So nitrates have large pre-systemic metabolism, or you can learn PSM. Nitrates have large PSM. If you find it difficult, nitrates have large PSM. Learn like anything. So nitrates are the nitrates. Nitrates are the nitrates. Have ka jo H hai, it is hydrocortisone. It is one of the steroid. Hydrocortisone. Never give hydrocortisone by tablet route, by oral route. Large ka jo L hai, it is lignocaine. It is a anesthesia. It is a local anesthesia. You know, lignocaine ka jelly comes. Lignocaine ka tablet don't come. Lignocaine ka topical ointment, jelly, tubes are available. But lignocaine ke tablets you may have not seen in the market. PSM का जो P है, it is propranolol. Propranolol is a beta blocker. इसके tablets आते हैं, but oral availability is very less because of the first pass metabolism. Systemic का जो S है, it is salbutamol. It is also a beta blocker. And metabolism का M is morphine. Morphine is a opioid. It is used as a painkiller. So tell me the full form. Who will tell me? The drugs with high first pass metabolism, the mnemonic is nitrates have large PSM. PSM is pre-systemic metabolism. PSM. Nitrates have large PSM. Tell me the full form. Can you try to tell me the full form? What is the full form? Nitrates is nitrates only. So it is nitrates, hydrocortisone, lignocaine, propranolol, salbutamol, the two beta blockers, and M is morphine, one of the opioid. Never give these drugs by oral route. Never give by oral route. Because if you give them by oral route, the bioavailability will be very less. If you give a 100 milligram or 100 gram tablet, out of the 100, only 5% or 10% will reach the blood for showing its action. The remaining 90-95% is excreted in the kidney even without showing its action. It is as it is excreted. It is metabolized and excreted. So these are the list of the drugs. Give me a thumbs up. Solve some mnemonics on, solve some questions on that. Have a look. This is the question. I'm sorry, just a second. Why it is not going back? Okay, this is the question. The drug having highest first pass metabolism. What is the name of that drug? See, the four options are in front of you. Is it theophylline? Is it aspirin? Is it tolbutamide? Or is it lidocaine? Apply your mnemonic. What is your mnemonic? Nitrates have large PSM, pre-systemic metabolism. So what is coming in this mnemonic? Out of the four options, lidocaine is coming. L is lidocaine. You all are right. The correct answer here is D. Swaraj, Anu, very good. Harmanpreet, Zool, very good. The correct answer here is D. Should I proceed ahead? The correct answer here is D. Let me come on order of kinetics. What is the order of kinetics? Most of the drugs follow two type of order of kinetics. Zero order and first order. I will not give you the details here, only a little bit detail before going on the mnemonic. Okay. Listen, there are two type of drugs. In the chemistry, you may have heard about the order of kinetics. Listen, the two diagrams are in front of you. In the two diagrams, you can understand the two diagrams. In the two diagrams, you can see the two kidneys. Kidney is the excretory organ, right? This is the afferent arteriole carrying the drug to the kidney. And this is the efferent arteriole leaving the kidney, and this is urine. The drug coming in the urine. Same here, this is afferent arteriole. This is efferent arteriole and this is urine. Listen, understand here what I want to teach you here. Listen, you tell me the correct answer. If I am giving 10 milligram of the drug to the patient, afferent arteriole contains 10 milligram. So this drug is going to the kidney for excretion. Kidney is excreting out of the 10 milligram, kidney is excreting 1 milligram per minute. So the remaining will come here. Whatever remaining, it will come here. So that is rate of excretion in the urine. So the drug present in the blood in the afferent arteriole is 10 milligram per ml of plasma, and it is coming in the urine is it can be any numbers. The numbers are just to ease your concept. The kidneys, just suppose it is excreting 1 milligram per minute. Just suppose, right? Here also I have taken the same numbers. Now I am taking three situations. Instead of 10, if the blood contain 100 milligram per ml, how much will be excreted in urine? If the blood contain 1000 milligram per ml, how much will be excreted in urine? Same I want to ask here. Why I'm asking the same question two times? Because there can be two scenarios. That's why I've drawn the double diagram. So my same question, instead of 10, if it is 100 and 1000, instead of 10, if the blood contain 100 and 1000, how much kidney will excrete in urine? Instead of 1, how much will it be there? So your answer should be that, ma'am, it depends on order of kinetics. Now, some drugs, as I've told you, some drugs follow 0 order and some drugs follow first order. See, if you are saying, ma'am, it is 0 order, so in 0 order, rate of elimination is constant. So whatever your blood concentration is this, whether it is 10, 100, 1000, 1 lakh, 10 lakh, 1 crore, whatever concentration, kidney will excrete same. Kidney will excrete 1, 1, 1, 1, 1. So kidney is, that is rate of elimination is constant. In 0 order, the rate, so remaining, if you are giving 10, 1 is excreted per minute, so remaining 9 is coming here. Every minute remaining 9 is coming here. If you are giving 100, still 1 is excreted and remaining 99 is coming here. If you are giving 1000, 1 is excreted, remaining 999 is coming here. So these drugs are dangerous. The drugs which follow 0 order kinetics, they are dangerous because they can cause toxicity even on increasing the dose. So it is not the thing. Sometimes in India, what happens now, we prescribe drugs to the patient. We are doctors. We say, take this drug at this dose. So patients start taking the drug and they are very smart. You know, they consider themselves that they are smarter than the doctors. So that 10 milligram is not causing any effect. Okay, let's take 100 milligram instead of 10. Don't ask the doctor, it's okay now. If you are taking 10, it is not showing action. We will take 100, it will show action. But they don't consider you are taking 10 if the drug is 0 order. 1 is excreted in the urine. So, and if you are taking 100, 99 will be remaining, the only 1 is excreted. So it is 0 order. The drugs are dangerous. They will accumulate in the blood and they can cause toxicity. So patient cannot increase the dose by themselves. If they are increasing the dose, they should ask the doctors before. So being a doctor, whenever you prescribe any drug to your patient, it is a 0 order kinetic. You should ask the patient, you should warn the patient, don't increase the dose by your choice. If you have any trouble, you call me, you come again and you ask me. Without my permission, you don't alter the doses. These drugs are dangerous drugs, right? They excrete in the kidney at a fixed rate. Whatever you will take, whatever dose, the excretion is same. So considering that excretion, this is the standard dose. Don't increase the dose beyond that. So that is the point. But what about the drugs which follow first order kinetics? So here rate of excretion, rate of elimination is directly proportional to plasma concentration. Here rate of elimination is constant. Whatever is the plasma concentration, it doesn't depend on plasma concentration, whether it is 10, 20, 100, 1000, whatever. Here it is directly proportional. So whenever the blood concentration is 10, 1 is excreted. Okay, that is the 1/10. Here, whenever it is 100, 10 will be excreted. That is again 1/10. And whenever it is 1000, 100 will be excreted. That is again 1/10. You got my point? So these drugs are not dangerous. So among all the drugs, you should know a list of 0 order. These are not dangerous. These are relatively safe drugs. So whenever you are a doctor prescribing any drug to your patient, you are a doctor, you should know, is it a 0 order drug? Yes or no? If it is a 0 order drug, warn your patient. If it is a first order, it's okay. It is safe. Give me a thumbs up if you got my point. Now let me give you a mnemonic for the 0 order drugs. So the 0 order drugs are in front of you. Everyone give me a thumbs up. There is a mnemonic for it. I'm having a mnemonic for it. The mnemonic is 0 watt. W-A-T-T, watt power. You know bulb, the bulbs have power. Power ka unit is watt. You may be knowing in physics. The unit of power is watt, W-A-T-T. Right, so 0 order kinetics is followed by 5 drugs. Name them. So W stands for warfarin. Warfarin is an anticoagulant, oral anticoagulant drug like heparin. Heparin is not oral. This one is oral anticoagulant drug, right? A, there are 2A. 1A is alcohol and 1A is aspirin. So double A is there. T, there are 2T. 1T is theophylline, 1T is tolbutamide. Give me a thumbs up. Theophylline is it is a type of it is a drug which is used in heart failure. So yeah, it is theophylline. It is one of the methylxanthin. Theophylline and tolbutamide. Power ka P is phenytoin. It is an anti-epileptic drug. I know you already know the classification. I'm assuming that. So watt power, W-A-T-T, watt, W-A-T-T power. Now many people drink alcohol. I guess many people in our country especially, they drink alcohol. So alcohol follows 0 order. It is dangerous. So whatever amount of alcohol, whether the person is drinking 1 pack or whether the person is drinking 10 pack together, the excretion is constant. Kidney is excreting same amount, right? So whenever, this is the reason why at 1 pack the person is in control, but why double, triple pack or 4 pack, after 5 pack the patient is uncontrolled. Why? He loses coordination. Why? Because the kidney is excreting at a constant level. So remaining drug is accumulating in the blood, and after accumulating in the blood, it is going in the CNS and causing the depression. First hyperexcitation, then depression of the CNS. So alcohol depresses the CNS. So ultimately, at very high doses, patient can go in coma and death. So that is the alcohol. We know the story. Give me a thumbs up. So what is the full form? Who will tell me the full form? Zero order kinetics ka full form. The mnemonic. What is the mnemonic? The mnemonic is what? W double A. Make double A. W double A double T. W double A double T. What power? Say the full form. Who will say the full form? So these are 6 drugs which follow zero order kinetics. Warfarin, alcohol, aspirin, theophylline, tolbutamide and phenytoin. Right? Am I right? Am I right? Yes, I am right. Everyone give me a thumbs up. We will solve some questions based on that. Just a second. Why it is not going back? Okay. Zero order kinetics. Here is a question. Zero order kinetics is followed by all of the following except. The question contains except. Who will tell me the correct answer? The 4 options are in front of you. Is it phenytoin? Is it barbiturate? Is it alcohol? Is it theophylline? Apply the mnemonic what power? W-A-double-A-double-T. W-double-A-double-T power. So apply the mnemonic. In this mnemonic, you can see what, apply the options. So yes, phenytoin, it is the P. It is the P, right? Alcohol, it is one of the A. And theophylline, it is one of the T. The other A is aspirin. The other T is tolbutamide and this is warfarin. But barbiturate is not coming in mnemonic. You all are right. This is how you have to apply the mnemonic, right? So correct answer here is B. Many question comes from order of kinetics, especially on zero order kinetics. So add this mnemonic in your table of mnemonics, right? On your page of mnemonics. Let me come on drug distribution. What mnemonic I want to tell you here? Drug distribution, volume of distribution. You know what is volume of distribution? Listen. So this is a drug taken by the person by oral route. The drug again going in mouth, in esophagus, in stomach, in intestine, getting absorbed from stomach and intestine. Till now, I guess every student know for absorption same medium is required. If you want to absorb acidic drug, give acidic medium. If you want to absorb a basic drug, give basic medium. So acidic drugs are absorbed from stomach, basic drugs are absorbed from intestine. I guess everyone knows. Anyways, the drug reached here in the blood. From the blood, where the drug will go? From here, where the drug will go? The drug will go to the site of action, right? The drug will go to the site of action for showing its mechanism of action. It is the free drug which will go here. The drug will go to the liver and get converted from non-polar to polar. And the drug will go to the kidney for excretion. So the concentration of the drug in the blood vessel will be falling. Gradually it will fall. You agree with my point, right? This is known as distribution. This is known as distribution of the drug is taking place. Distribution means from the blood, the drug is going to various organs. It is going to its site of action for showing mechanism of action. It is showing to the liver for doing metabolism, for converting non-polar to polar, for showing biotransformation. And it is going to the kidney for excretion. So gradually the concentration in the blood vessel fall. Do you agree with my point? Yes, of course you have to agree. Gradually, if I consider there is no organ in human body and all the drug which I am taking, I am directly giving IV drug and all the drug remaining here only, then the volume, normally humans have 5 liters of volume. Now the value will not be 5 liter, it will be 20 liter, 30 liter. That's why it is known as apparent volume of distribution. It is not a real. You got my point? It is apparent volume of distribution. So just a second. Yes. Okay, yahan pe I want to tell you, yeah, apparent volume of distribution. I will come on that point. One more point I would like to teach you here, the same diagram. Okay, listen now. Whatever drug the patient take, listen, the drug taken by the oral route, the drug is going in the mouth, esophagus, stomach, intestine, getting absorbed, reaching in the blood. One more point I forgot to tell you here. After reaching in blood, a small proportion, a variable proportion of the drug bound with the protein. So in the blood, a drug is of 2 types. The drug which is not bound with the protein is known as free drug, FD. And the drug which is bound with the protein is known as bound drug, BD. You can see the red is the drug and blue is the protein. Give me a thumbs up. Name the protein. ये प्रोटीन कौन सा प्रोटीन है? It depends whether the drug is acidic or basic. If the drug is acidic, the protein is albumin. And if the drug is basic, the protein is alpha-1 glycoprotein. So this is the protein. Okay, ये दोनों भी MCQ हैं. These two are also PYQs in your papers. So this is the bound drug. Okay, so you will say, ma'am, why you are telling here this in mnemonic? Why? What is the use of this? Okay, listen. Imagine this is a young boy, a 15-year-old young boy. He tried to commit suicide by ingesting, overdosing of a drug. So he has taken 100 tablets together of some drug. Whether the drug is acidic or basic, I don't know. He has taken so many tablets of one drug trying to commit suicide, or it is an accidental ingestion, or it might be homicide. Now, the parents, the relatives are carrying the boy to you. You are a doctor. Doctor, save my child. Accidentally or suicidally or intentionally or homicidally, the boy has ingested excessive amount of a drug. You will say, Ted, show me the empty strip. which drug the boy has ingested. So it may be any drug, it can be acidic, basic. So whatever drug the boy have ingested, all the drug already reached in the blood, right? In the blood, now the drug is of two forms. Some drug is free drug and some drug is bound drug. Now various drugs have variable this proportion. You will ask, ma'am, how much will be the 50, how much will be the free, how much will be the bound? I cannot tell you that. Various drugs, you tell me the name of the drug. According to that, I will tell you kiska protein binding kitna percent hota hai. There are some drugs which are only 10% free, 90% are bound. There are some drugs in which 90% is free and 10% are bound. It depends on plasma protein binding of the drug. Plasma protein binding, PPB of the drug. So various drugs have various PPB, right? Imagine the first situation. Imagine the first, now there is a rule. Now in this case, most of the doctors, you're a doctor now, what treatment you will offer? The drug is already absorbed. You try to vomit the patient, you try to do the gastric lavage. In vomiting and gastric lavage, whatever drug present in the stomach and intestine and not yet absorbed, that will come out. Okay, I got it. But what about the drug which is already absorbed? Which is already absorbed and reached in the blood. In the blood, it is present in two forms. Now you want to save the child. So what you want? Jo already absorbed ho gaya hai, how you will take it out? So only way is excretion. You want to excrete the drug. You want to excrete the drug. From the blood, maximum drug should be excreted, right? Excretion ke liye you will cause diuresis. ठीक है, you will give a diuretic, you will cause diuresis. It's okay. There is one more way. The way is known as hemodialysis. There is a machine which is known as dialysis machine. So in that, what you do, you take the blood out. You put the blood here. In this machine, there are pores. There is a filter. The filter contains the pores. Chai ki channi ki jaise filters hain isme. There are pores. So you take the blood, you just filter the blood. You just filter the blood. So blood will come via the pores and the filtered blood is re-injected. So will this method useful here to save the child in case of poisoning? Is the hemodialysis is useful? You are a doctor now. Parents are crying in front of you. Doctor, my boy, just results are announced. He failed and he just committed suicide. So please save our child. He has ingested this drug, 100 tablets of phenobarbital, 100 tablets of diazepam. So he has ingested atropine, dhatura. So please save our child. So what you will do at that point? What? So you will try to do the gastric lavage. You will try to do vomiting. Usme unabsorbed drug, the drug which is unabsorbed yet present in the stomach, that will come out. But what about the drug? Parents are already late. Most of the drug is already absorbed in the blood and the child is dying in front of you. What you will do? Will you offer hemodialysis to the patient? That is my question to you. Yes or no? Yes or no? So you cannot say directly, yes, Prabhakar, Swaraj. No, directly you cannot say hemodialysis you can offer. It depends the plasma protein binding of the drug kitna hai. Here comes the role. How much drug is free? How much is bound? Different drugs have different this proportion. Now listen, there is a rule. From these pores, the hemodialysis may have a filter. The filter have a pore. From these pores, proteins pass. Proteins are not filtered. Proteins do not filter. Protein pass from the pore. Whatever protein is coming here, the same protein will come out. Filter cannot stop protein. So the drug which is bound with the protein cannot be stopped because you cannot stop the protein, you cannot stop the bound drug. You cannot stop the bound drug. So those drugs which is having high PPB, 90% is bound to the protein, there is no use of doing hemodialysis. So if you do the hemodialysis, the 90% of the drug will go here with the protein and come back with the protein, come back. So the summary is that, here is the summary. So there are two type of drugs. The drugs which is having high plasma protein binding and the drugs which is having low plasma protein binding. Listen now, the drugs which have high plasma protein binding means the free drug is less. It is only 10%, imagine. And the bound drug is more because plasma protein binding is more. It is 90%. And here the reverse will happen. Plasma protein binding is less. So the bound drug is less. Bound is less. It is only 10%. And obviously the free will be more now. So free will be, total is 100. Free will be more, it is 90. Now patient is coming to you. There are two patients. Patient A, patient B, both are poisoning cases. Both are suicidal cases. Both you want to save both the child. So in which you will offer hemodialysis, in which you will not offer hemodialysis. That is my question to you. In one of the case, you will offer the parents, please do hemodialysis. It will be useful for your child. Give the consent. I will start the process. So in one of the child, you will explain hemodialysis is of no use here. We will try some other methods. We will try dialysis. So we will try some other post dialysis or diuresis or something else. But hemodialysis is of no use. In which patient A or patient B, the two patients are in front of you. Can you tell me the patient which is having high bound form? Bound form means 90% of the drug is bound with the protein and hemodialysis machine cannot stop protein. So hemodialysis protein cannot stop the 90%. So if you do hemodialysis here, only 10% of the drug will be taken out of the blood. So there is no use of hemodialysis doing here. You can offer hemodialysis here. If you do hemodialysis here 90% of the drug will be absorbed, can be stopped. Give me a thumbs up. Everyone give me a thumbs up. So what you are saying, I don't know. My answer is that the drug which is having high plasma protein binding, don't offer hemodialysis. So tell me the list of those drugs. It is an emergency situation. You should know the list of those drugs where hemodialysis is not useful. It is not useful. Rest all hemodialysis is useful. So you are a doctor. If any poisoning case is coming to your clinic, in your OPD, in emergency, so this is the hemodialysis ka list. Hemodialysis is not effective in these drugs because all these drugs have high plasma protein binding. They have 90% of the bound form. They have less free form. So the mnemonic is avoid dialysis. The mnemonic is very simple. Avoid dialysis in such patient. So A stands for amphetamine. You know what is amphetamine. V stands for verapamil. V stands for verapamil. O stands for two things, organophosphates and opioids. Organophosphates are present in pesticides. You know, it is the most common suicidal agent used by many patients, many persons. Opioids are, you know, opioids. They are used for pain, right? I is imipramine. D, there are two D. One is digitalis, one is diazepam. Diazepam is a sedative. So it is also a very common drug for committing suicide. The pain, the sleeping pills. Diazepam. Everyone give me a thumbs up. So avoid dialysis is the mnemonic. Avoid dialysis. I have not put a question here, but you can imagine many questions come on this mnemonic. So a clinical situation will be present in front of you. A boy is there, 19-year-old boy tried to commit suicide, ingesting a drug. The drug which is ingested is having high ppb and relatives are asking to save the child. Will hemodialysis will be useful in this drug? Yes or no? The four options will be in front of you. So you can pick up according to the situation, what is asked in the question, apply the mnemonic. You got my point? In these 5 or 6 drugs, don't offer hemodialysis. Don't do. It is wastage of time. Time is very important in case of emergency. You are losing time. You can try some other effective treatment in that time. You are losing your energy. You are losing your money, right? So don't offer hemodialysis in such patient. Everyone give me a thumbs up. Everyone give me a thumbs up. Should I proceed ahead? The next mnemonic which I would like to add here, the next mnemonic is the therapeutic dose monitoring. What do you mean by therapeutic dose monitoring? What do you mean by therapeutic dose monitoring? What do you mean by therapeutic dose? Therapeutic range. Therapeutic range क्या होता है? So all the drugs have a range. You know, they have a range. They have a working range. Being a doctor, we know the range. For paracetamol, if any patient come to me with pyrexia, fever or with pain, right? So I will offer an antipyrexic and analgesic drug. The best drug is PCM, paracetamol, right? PCM, paracetamol is the best drug. It is antipyretic also, analgesic also I will offer. So what is the minimum dose for an adult? Which is the functional dose, the minimum dose for an adult for paracetamol? Of course, it is 500. 500 is a chota, it is not used. It is a pediatric dose. For adult, minimum is 500. Maximum in one day, the patient can take 2000. So I will ask the patient to take 500 paracetamol multiple times in a day, every 4 hours, every 6 hours, every 8 hours, whenever required, but not more than 2000 total dose in 24 hours. So this is the working range for this tablet. For age-wise, for gender-wise, it differs. It is an adult dose. Pediatric, it can be different. Elderly patient, it can be different. So this is the range. The range is very wide, 500 to 2000. Come on, it is a very big. So patient is taking 500, it's okay. 700, 900, 1000, 1500, it's okay. It's okay. It is a wide range. But there are some drugs in which the range is very narrow range. The working range is only 0.3 to 0.5 milligram one day. The plasma concentration. The drug is non-functional below 0.3. And drug will cause severe toxicity above 0.5. So you strictly have to stick between 0.3 to 0.5. How you will be strict? So you will say, ma'am, I will give that tablet only, that concentration tablet for the patient, oral drug. But absorption is different now. In some patient, absorption is more. In some patient, absorption is less. So it is not constant for all patients. Just suppose if I am taking a tablet of 10 milligram, in my body only 2 milligram is absorbed. If you are taking the same tablet, instead of 5 milligram is absorbed. So it can happen. The intestinal absorption can be different. Stomach absorption can be different. Bioavailability can be different for different patient. So thoda bahut variation to hota hai. But here range is very narrow. You cannot afford the variability. What you will do? So in such patient, you start with the smallest dose. So because at high dose, they will cause toxicity. At smallest dose, you just start. And after asking the patient to take the tablet, the next day, ask to give the blood sample. Blood sample in a test tube. Take the blood sample in a test tube. In this blood, check the concentration of the drug in the laboratory. In the laboratory, the laboratory person will in the report, they will write how much drug, how many milligram of the drug is present in the blood. So we will come to know that when we give 10 milligram of tablet to this person, this much is absorbed. This is the blood concentration. So this is known as therapeutic dose monitoring. So patient has to take the blood sample. The patient has to give. So if I take any tablet, you are a doctor, how many times you prescribe to give blood sample to check the drug concentration in the blood? We ask the person to give the blood sample for doing various investigations. But have you ever asked your patient to give the blood sample not to do the investigation, to check the drug concentration inside it? How much drug is absorbed after giving? So that is known as TDM, therapeutic dose monitoring. So we ask the patient to give blood sample in the laboratory periodically, every week, every alternate day, depending how dangerous is the drug. So how narrow is the range, depending on that. And they have to do TDM. You got my point? This is known as TDM. So list the drug. Being a doctor, of course, you should know the list of such drugs. So this is the list of drug. So TDM, that is therapeutic dose monitoring. You ask the patient to give a blood sample after taking the drug, and in the laboratory submit the drug, right? So the laboratory it will be checked how much is the concentration of the drug in the plasma, right? So I will not assume that I am taking 10 milligram, 9 will be absorbed, 8 may be absorbed. No, maybe. No, maybe ka kaam nahi hai. You have to be sure shot here. It is not maybe. So for becoming sure shot, you have to do the blood test for the checking the plasma concentration of the drug. So TDM is done for which drug? What is the mnemonic? I am having a mnemonic for that. A drug possessing low TDM, a drug possessing low therapeutic index. So A is aminoglycosides. You know, aminoglycosides are antibiotics. What is their side effect? Their working range is very narrow. If you increase the working range, patient will become deaf, permanent deafness. So permanent hearing loss, sensory neural hearing loss will be there, permanent deafness will be there. The cochlear deafness as well as cochlear damage as well as vestibular damage. So the ototoxic drug is there. That's why you have to do TDM here, especially gentamicin, right? Especially gentamicin. Drug ka jo D hai, it is digitalis. You know, digitalis is an inotropic drug. It is used in heart failure. It increases the inotropic activity of the heart. You may be knowing the mechanism. I taught you this drug in heart failure drugs. So it is also having a very narrow range. Possessing ka jo P hai, it is phenytoin. It is an anti-epileptic drug, right? Low ka jo L hai, it is lithium. Lithium is drug of choice for bipolar disorder. There are two types of psychiatric disorders, depression and mania. In some patients, both occurs alternatively. Sometimes they are depressed, sometimes they are manic. Sometimes they are depressed, sometimes. So this is known as bipolar disorder. The bipolar disorder, the drug of choice is lithium. Lithium is a mood stabilizer, right? You may be knowing that, right? So lithium is there. Therapeutic ka jo T hai, it is TCA. That is tricyclic antidepressant drugs. These drugs are given in depression. Lithium is given in bipolar disorder. TCA are given in only in depression, not in mania, right? And index ka jo I hai, it is immunomodulator, a drug possessing low therapeutic index. Everyone gave me a big thumbs up. You got my point? So these are the drugs for which TDM is required. You can imagine how many questions can be created from this beautiful mnemonic, and I have not put the questions because it is taking time. After every mnemonic, if I give the question from the previous year, so I cannot teach you many mnemonics. So I'm just giving you, firing the mnemonic so you can see the question by yourself, right? You got my point? Okay, there is a question for you. TDM is useful in, it is a question few years back, NEET PG. TDM is useful in which of the following drug? The four options are in front of you. Is it a diuretic? Is it a metformin? Metformin is used in diabetes. You know, drug of choice for type 2 diabetes. Levodopa, that is drug of choice in Parkinsonism. And digoxin, drug of choice in heart failure. So you tell me what is your answer? What is your answer? Write down your answer in the chat box. Nikhil, Soumya, Swaraj, Osama, very good, very good. Apply the mnemonic. The mnemonic is a drug possessing low therapeutic index. This is the mnemonic. So in this mnemonic, apply the options. What are the options? What are the options here? Apply the options. So D, here D is digoxin. Yes, so the correct answer here is D. D is not diuretic. So knowing the full form is important. If you know only mnemonic and you don't know the full form in the exam, you will get confused ki D kya tha. D digoxin hai ki D diuretic hai. So D is digoxin, not diuretic. Here L is there, but this L is lithium. This L is not levodopa. Again, if you don't know the full form, you will get confused. This L is lithium. This L is not levodopa, and metformin is not coming at all in this mnemonic, so there is no confusion. So the correct answer here is D. I guess every one of you got it. Give me a thumbs up. The correct answer here is D. The next question is in front of you. This is a question from FMG, last to last year, FMG. You can solve the question, which of the following drug requires TDM? So these are the drugs a doctor should know. Being a doctor, you should know the list of the drugs. So whenever any of these drugs you are prescribing to your patient, ask the patient to do TDM. You know how to do TDM. Ask the patient to submit the blood sample in the laboratory for checking the concentration. plasma concentration of the drug in their blood. You got my point? So which of the following drug require TDM? The 4 options are in front of you. Is it phenytoin? Is it metformin? Is it warfarin? Is it propranolol? You know the 4 categories of the drug. What is the answer here? So most of the students are saying phenytoin. Is it so? Phenytoin? Yes. The correct answer here is phenytoin. So what is the mnemonic? Can you apply the mnemonic? A drug possessing. A drug possessing. Possessing ka P is phenytoin. That's why the correct answer here is phenytoin. Low therapeutic index, right? Possessing ka P is phenytoin. Possessing ka P is not propranolol, right? It is not. W is not at all coming in this mnemonic, and metformin ka M is not at all. So no confusion. Students will have confusion between A and D because both are PP, but here P is phenytoin, not propranolol, right? So the correct answer here is A, and you all are right. So this is how these mnemonics are useful for you. Everyone give me a thumbs up. Everyone give me a thumbs up. Till now, can you help me in revising what mnemonics we have learned in today's class? Where we have started. The first mnemonic today I taught you is a mnemonic for prodrug. The first mnemonic is the mnemonic for the prodrug. After prodrug, I guess I told you the mnemonic for high first pass metabolism. First pass metabolism. After that, I told you the mnemonic for if you have note down in your copy, can you read it and tell me kahan pe humne mnemonic kiye? I have told you enzyme inducers. I have told you enzyme inhibitors. Inducers, inhibitors. What else I have told you? I have told you the drug possessing therapeutic where TDM is required, where therapeutic margin is low. So these mnemonics I have told you. What else I have told you till now? I have told you many one now. I have told you where hemodialysis is not useful. The mnemonics where hemodialysis is not useful, right? What others? Yes, I have told you the mnemonic for zero kinetics. Zero kinetic. What else? If I am missing something, please write down. First enumerate. I will write the mnemonics. First enumerate. और क्या बताया है मैंने आज तक? अभी तक from the beginning of the lecture, what else I have taught you? Anyone else? If I am missing something, okay. If I am missing something, please write down in the chat box. I will read it. Okay. Okay. So write down the prodrug. What was the mnemonic of prodrug? Can you just revise it simply just in 2 minutes? Prodrug का क्या mnemonic था? What was the mnemonic for the prodrug? Mnemonic for the prodrug. All clinical subjects try to do MD in clinical subjects. What is the mnemonic? Can you tell me the mnemonic? Okay, first pass ka kya hai? What is the mnemonic for the first pass? Can you write down the mnemonics? Till now, what mnemonics I have taught you? What is the mnemonic for inducer? Inducer is GPRS, cell, phone, battery, dead. So this is inducer. What is the mnemonic for inhibitor? Vitamin K cannot cause enzyme inhibition. Enzyme inhibition. Okay. Prodrug, all prefer doing MD in clinical subjects. Yes. Yes. First pass mein nitrates have large PSM, pre-systemic metabolism. Nitrates have PSM, large PCM. The drug possessing narrow therapeutic margin or requires TDM. A drug possessing low therapeutic index. Give me a thumbs up. The drugs in which hemodialysis is not useful. Avoid dialysis. Avoid AVOID. Avoid dialysis. Double D is there, right? Avoid dialysis. The drugs having zero, the drugs following zero order kinetics, they are very dangerous. They accumulate in the blood if the dose is increased. So what power? WAAT. What power was the mnemonic? I guess till now these are the mnemonics I taught you. So writing mnemonics is not important. Saying the full form is important. So I'm not saying the full form. It will take time, but I request all of you to accumulate or gather all the mnemonics at one page, whatever I'm giving you. So these are the only halfway done. So many more I'm going to give you ahead also. So please gather all the mnemonics at one place, and I request all of you before going your exam, please have a look on them. I can guarantee these mnemonics, if you revise all of them, many questions in your exam, the patho, pharma, medicine, many questions will be cracked from these mnemonics, and they will help you somewhere. In clinical questions also, if it is not directly on the options, indirectly also in understanding the question, they will help you. So, okay, after that, I would like to move ahead. Everyone give me a thumbs up. Shall I move ahead? Okay. Yeah. So let me teach you the type of the receptors. There are 5 types of receptors. The 5th one is important, for which I am having a mnemonic. The 5th one, what is a receptor? Do you know what is a receptor? Drugs acts via receptor. The drugs act via receptor. Can you see this is the cell? This is the nucleus of the cell, and there is a cytoplasm. On the surface of the cell, there are receptors. These are known as receptors. So various drugs come and bind with their receptors to show their action. So this is a drug. Drug bind with the receptor and it shows its action. There are 5 types of receptors. The first 4 I will teach you some other day in pharmacology in detail. The fifth one are important because these receptors, the 5th one, they are not present on the surface. The receptor are present either in the cytoplasm or inside the nucleus. So receptor is present either in the cytoplasm or in the nucleus. So what in this case, the drug have to be dissolved. So drug have to dissolve in the cytoplasm and come and bind here or here. So these type of receptors are known as these. These are the receptors. So these are special type of receptors. These receptors are known as receptors regulating gene expression or transcriptional factor receptors. These are present intracellular. These are not present on cell surface. I will give you a mnemonic for that. First understand what I am teaching you. If I directly throw a mnemonic, you will not understand, ma'am, what are this mnemonic for. So first understand the concept. The mnemonic is for what, right? It is a mnemonic for the receptor which are present intracellular. These receptors are special receptors. They are not present on the surface of the cell. They are present intracellular. I will show you the diagram from the KDT. These are known as transcriptional factors, or these are known as receptors regulating gene expression. These are present either in the cytoplasm or in the nucleus. Give me a thumbs up. The drug should be lipid soluble so that drug can dissolve and go inside the cytoplasm. For lipid soluble drugs, these are the receptors. For lipid insoluble drugs, these are not the receptors. These are the slowest acting. Is pe bhi MCQ hai. These are the slowest. There are 5 types, right? Among them, these are the slowest one. These are the slowest one. I will teach you all 5. Don't worry. But currently, let me teach this. Can you see a cell? Let me show you the boundary of the cell. Those who have missed it. See, this is the cell. This one, outermost, is the boundary of the cell. Can you appreciate the boundary of the cell? Inside the boundary of the cell, appreciate the cytoplasm. Please, everyone, appreciate the cytoplasm. And inside the cytoplasm, appreciate this is the nucleus. This is the nucleus. Okay, let me show you where is the drug. Where is the drug? I will draw the drug. So this is the drug. Okay. Yes, this is the drug. Can you see? This is the drug. It is a steroid. It is a lipid soluble drug. So it is dissolving and it is coming inside. It is coming inside. It is coming in the cytoplasm. So where is the receptor? The drug is already in the cytoplasm. Where is the receptor? Can you show me the receptor? The receptor is S-shaped. Can you see S or Z? S or Z, whatever you say. So this is S-shaped receptor. In the S-shaped receptor, it is a protein. This receptor is a protein having an amino terminal and a carboxy terminal. It is a protein. So at the carboxy terminal, drug binds with the receptor. It is an MCQ. The drug binds with such receptor at carboxy terminal, not at amino terminal. At the amino terminal, they have some inhibitors which are known as heat shock protein, HSP. Heat shock proteins inhibit the receptor. The receptor is currently present in the cytoplasm. Listen, when the drug is coming, the drug is dissolving. The drug is a lipid soluble drug. It is dissolving in the cytoplasm, coming in the cytoplasm. After coming in the cytoplasm, the drug is binding with the receptor at carboxy terminal. So heat shock protein will leave the receptor and the receptor will become active. Now 2 receptors bind together and they form a dimer. See, this is the first receptor having the drug inside it. This is the second receptor having the drug inside it. So this is a dimer. So 2 receptors are forming a dimer and both of them heat shock protein is not present. Heat shock protein already left the receptor. Receptor become active. They form a dimer and after forming a dimer, they enter the nucleus. So they enter the nucleus carrying the drug. This is the DNA. Can you see the DNA, double-stranded DNA? On the DNA, genes are present. Genes are present. So the receptor will bind with the genes and stimulate certain genes. These are known as zinc finger. इस पे भी MCQ है. कितने सारे MCQ cover करा रही हूँ मैं. I'm covering all the MCQs based on this. This is known as zinc fingers. Via zinc fingers, this receptor bind with the genes and stimulate the genes. Some genes are stimulated. When genes are stimulated, transcription and translation takes place. So transcription takes place, mRNA is formed, and translation takes place on the ribosome, protein is formed. And this protein will show the effect of the drug. So ultimately the effect of the drug is shown by this protein and this is the mechanism. Now let me show you the drugs which follow this mechanism, a list of the drugs. Give me a thumbs up. So first see the mechanism. इसके mechanism पे भी बहुत सारे questions हैं. So what is the mechanism? Who will tell me the mechanism? What is the mechanism? Here the drug is a steroid which is a lipid soluble drug. It penetrates the cell. It goes in the cytoplasm. On going the cytoplasm, it binds with the receptor. It binds on the carboxy terminal of the receptor. After binding, the heat shock proteins leave the receptor. It dissociates the receptor and receptor will become active. It will form a dimer. After forming the dimer, the dimer will go to the nucleus. The dimer will go to the nucleus. You can see after going in the nucleus, the dimer The dimer go to the nucleus, it binds with certain gene with the help of zinc fingers. And after transcription and translation, protein is formed which will show the effect of the drug. So this is how the mechanism takes place. First, everyone give me a thumbs up. Everyone. Now this is the mnemonic. The mnemonic is in front of you. Name the drugs which follow this mechanism. Now name the drugs जिनके receptors are present. Nuclear receptors are these receptors are nuclear receptors. So the receptors are present in the nucleus or the receptors are present in cytoplasm. The receptors are not present on cell membrane. They are either present in nucleus or present in cytoplasm. So name the drugs. Name all such drugs. So the mnemonic is road trap fixed. The mnemonic is road trap fixed. Let me tell you the full form. Road trap fixed ka R stands for the first drug, that is retinoic acid. Retinoic acid. R is retinoic acid. O is estrogen. It is a female hormone, estrogen. A and E, D are the two vitamins, fat soluble vitamin, vitamin A, vitamin D. इन पे बहुत MCQ आते हैं. You may have seen the MCQs on this. So retinoic acid, estrogen. This is retinoic acid, estrogen, vitamin A, vitamin D. Trap, T is thyroxine. Hypothyroidism patient takes thyroxine daily. You may be knowing that. R, there is one more R. It is also retinoid. That is retinoic acid. Right? A you can leave, or A is AHR. It is aryl hydrocarbon, right? And P is PPAR, right? So this is road trap fixed. Okay, fixed you can leave. So these are the drugs which have such type of receptor. Now I have a question. So see, all of the following work on the nuclear receptor except. It is a question of last year FMG. Last year FMG. Last year May FMG. May or June, whatever you say. June FMG. Last year. Right, matlab last to last paper. Every year you have two papers now. So this is the question. All of the following works on nuclear receptor except. The question have except. Apply your mnemonic. What is your mnemonic? The mnemonic is road, ROAD, trap, TRAP. Road trap is the mnemonic. Fixed ko rehne do. Road trap is the mnemonic. So apply the mnemonic. So in this mnemonic, vitamin A, yes it is coming. Vitamin D, yes it is coming. Thyroxine, yes it is coming. But glucocorticoids is not coming. So glucocorticoids don't have nuclear receptors. So the correct answer here is A. So not only this, many questions come on this mnemonic. So this is my next mnemonic, road trap. You got my point? Everyone give me a thumbs up. Everyone give me a thumbs up. Now coming on the next mnemonic. Now there are whenever you will start practicing, now of course you are a doctor, once you will get your license, you will get your degrees, you will do your specialization, super specialization, by God's grace you will start practicing. Of course, whenever you will start practicing, many patients come to you. Some of the patients will be females which are pregnant. The pregnant females, they will be your patients. Sometime, so patients will come, the females will come, the ladies will come to you with their complaints. Doctor, I'm having this. Sometimes in India, the females are very shy. They don't proactively tell you that I am pregnant. You have to ask the lady, are you pregnant? If you are looking at a young or middle-aged lady and the lady is in the fertility age, you should ask. So before writing any drug, you should ask, are you pregnant? Are you sure you are not pregnant? Because the drug which I am giving is not safe for the baby. So if you are pregnant, let me know. I will write those drugs which are safe for the baby. So you should always know which drugs are safe in pregnancy, which drugs are not safe in pregnancy. You got my point? You got my point. So pregnancy wise, we divide the drug into 5 categories. So the 5 categories are in front of you. Category A, category B, category C, category D, category X. First understand the meaning of these categories, then I will let you know the drug inside each category. Category A is absolutely safe in humans. Human trials are done. Human trials are done and it is safe in human. It is safe in human. It is proven. Many studies are done. So consult the lady. It is safe for the baby. Don't worry. Many human trials are done and in all the trials, the result is same. It is safe for human babies. It is safe for human fetus, human embryo. So don't worry. So while prescribing these drugs, you don't have to bother. You don't have to bother. So drug in this category, there are 4 drugs you have to learn. It is levothyroxine. So if thyroidism is there, hypothyroidism to the lady, you can give levothyroxine. Folic acid. We always give folic acid to the pregnant lady for the first trimester or second trimester. Magnesium sulfate. In case of epilepsy in pregnancy, we give magnesium sulfate as a treatment, you know. And leothyronin. So these are the drugs. Leothyronin, yeah. So it is levothyroxine. So these are the drugs which are safe in pregnancy. They belong to category A. Category B is a category in which human trials are not done, but animal trials are done and it is safe in animals. So, you know, for doing the trials, you have to fill the consent form. Now, there are many pregnant ladies. We will ask the pregnant lady to participate in the trial. It is absolutely free trial. It is for the benefit of the community. We will give you a drug during your pregnancy, and after delivery we will see what is the effect of the drug on the fetus. Will any lady will allow you? No. Whatever amount you will offer to the lady, no lady will allow you to participate. No lady will give the consent. So that's why human trials are very less in this category, right? In other diseases, patient give consent. If they are poor, or if they are needy, or if there is no treatment available, they give the consent. But pregnant ladies, they don't give the consent. They do not want to take a chance for their upcoming babies, right? That's why the human trials are less. But we have done the trials on the monkeys or other animals. They are safe. They are safe. So these are the list of drug of category B. So it can be metformin. So I will consider these as safe. So if a patient is diabetic and she is pregnant, I can give metformin without any hesitation. It is safe. Hydrochlorothiazide, it is a diuretic, right? I can give for the edema. Chlorbenzaprine and amoxicillin and PPI. Pregnant ladies usually have acidity. So I can give PPI. PPI are safe in pregnancy. For acidity, you can give PPI. Amoxicillin is antibiotic. If pregnant lady have cough, cold, fever, some bacterial infection, I can give amoxicillin. It is a penicillin, right? So these are safe, but human trials are lacking. The third, of course, category C, human trials are not done. Human trials are not done, and animal trials the results are not, the results are, borderline. They are not good, they are not bad, right? So the results are not ruled out. We are not sure. Whether these are good or bad, we are not sure. We are not sure. So tramadol, gabapentin, amlodipine, trazodone and prednisolone. Steroids are coming here. So never give steroid to a pregnant lady if you are very, if you don't have any other choice, right? The category D, of course, the risk is more. It is proven that is the risk is more. So avoid these drugs. Don't give any pril, any ACE inhibitor. Don't give alprazolam. That is a sleeping pill, right? Sedative. Don't give losartan, clonazepam, lorazepam, right? And category X is contraindicated. These are the drugs which are teratogenic. These are proven teratogenic drugs. If you are giving this drug, you are harming the baby. Definitely proven you are harming the baby. So the list is atorvastatin, simvastatin, the statins for cholesterol lowering drugs, right? Warfarin, it is an anticoagulant drug. Never give warfarin. To a lady in pregnancy, you can give heparin. Don't give warfarin, right? Methotrexate, and it is an anti-cancer drug. And finasteride. So these are the list of the drugs. Have you got it? Now let's solve some questions on it. So category A or X should be at the tip of your tongue. You should know all the drugs which are safe, and we should know all the drugs which are contraindicated, right? It's your choice to learn BCD also. I guess everyone got it. Everyone see the question. Category X in pregnancy, I'm asking. Category X are all except. I'm asking except. Which of the following is not belonging to category X? Who will tell me? So warfarin. Is it warfarin? Is it alprazolam? Is it methotrexate? Or is it simvastatin? What is the correct answer here? Of course, in the category X, the correct answer here is C. You can see the table. In the category X, alprazolam is not coming. Alprazolam is category D, not X. In X, other three options are there. You can see warfarin, you can see methotrexate and simvastatin. All statins. They are in category X. Yes, the correct answer is C, because alprazolam belongs to D, not X. Alprazolam is not teratogenic, but yeah, its risks are more than benefit. Risk is more than benefit. So there are many more mnemonics. It is not over. The lecture is not over. But the thing is that after 15 minutes, I'm having my next lecture on Unacademy app, the free lecture, but not on YouTube. So I have to stop this lecture right now, right? So give me a minute. Let me announce my next lecture, then you people can go. Okay. So I guess here I am. I guess this one, just a second. Okay. So here I am. So just after 15 minutes at 11 a.m. sharp, right now, I'm having my next free class. I'm going to teach you pathology. Pathology last minute revision. This revision is basically for the aspirants who are going to write NEET PG, FMG and INI-CT, FMG in the next few days. So it is a rapid fast revision, only the important points in the pathology. So I have already covered the general pathology yesterday. Today I will cover systemic pathology. So I'm having two lectures, one at 11 o'clock, one at 12:15 p.m. Today only, back-to-back two lectures. The two lectures are free, but they are not on YouTube. They are on Unacademy Learners app. So those who have already installed Unacademy Learners app, it's good. Those who have not installed, it is an app. Go to the Play Store, install the Unacademy Learners app from the Play Store. After installing, they will ask you to select a category, to select your goal. Select the goal as NEET PG. It is a category for all medicos. Whatever exam you are preparing, NEET PG, FMG, INI-CT, USMLE, select this as a category. After selecting this as a category, search my name under educators. My name is Dr. Priyanka Sachdev, right? If you search my name, you will find my profile link. Just follow my profile link. If you follow my profile link, you will get notification of all my free classes from tomorrow. You will never miss my class, and you will get a list of more than 500 to 1000 recordings, the free recordings which I have already taken in the past. You can watch any recording of your choice, any topic of your choice. The PDF of the notes is also available. All the recordings are free. They are available on the app. The only thing you should know a code to unlock it. So code is my surname. Please note down. It is Sachdev. Sachdev. Sachdev 10 is the code. Please use this code for unlocking any free recording on Unacademy and distribute this code to all the medicos in your knowledge, in your contact. Thank you very much for being with me. And yeah, these are the free classes on Unacademy. On Unacademy, we have paid version also. You can imagine if free version is so knowledgeable, so impressive, and how the paid version will be. So you can give a trial if you wish, right? We have 3 types of subscription. In Plus, you will get only Unacademy lectures, live and recorded. In Iconic, along with Unacademy, you will get Prep Ladder also. And in Light subscription, you will get only test series, right? Whatever, the various plans are available in front of you along with the prices. Whatever your choice, requirement, wish, you can opt for that plan. You can notice one thing, longer the plan, cheaper it is. If you are a first prof, second prof student, why don't you go for a 4-year, 3-year, 2-year plan? Cost-wise, per month-wise, it is cheaper. But if you want to give a trial first, go with a 2-month plan. Give it a trial at least. So if you like it, you can extend it. If you don't like it, it's okay, right? So give it a trial. Before purchasing any of these plan, before payment, apply my code Sachdev10, you will get maximum discount. So write down the code for discount. It is SACHDEV, my surname, Sachdev10. Without space, it is 10. So SACHDEV, Sachdev10 is the code for getting maximum discount on all these plans on Unacademy. Thank you very much for being with me. I'm expecting all of you to join me at 11 o'clock for pathology. Thank you very much. I'm ending this lecture and hoping to see you on the app. Thank you. Bye-bye. Study hard.